So phase one is going to be, we talked about a couple strategies not to irritate your right hip. So you're going to be about 6 inches off the wall, so you're in less hip flexion.
Okay.
And then you're going to slide your right foot down the wall in order to assist with bending your knee further.
Mm-hmm.
You're going to find a position where it's stiff but not painful. Okay. And then you're going to hang out for 1 minute.
Okay.
After your 1 minute, then you're going to go ahead and kick out, build pressure. So you're trying to straighten your knee. So if this was your knee, you're trying to kick it up the wall. Yep, and you're doing a really nice job of holding it back with the restraint of the strap as well as your opposing leg. And what's happening right now is your quadricep is putting forces into the joint capsule and helping to induce architectural changes within the fascia as well as the joint capsule of the knee to assist with your improvement in knee flexion. Over 30 seconds, you're gradually ramping up to your safest, greatest contraction as hard as you can go. After your 30 seconds, you're going to do the opposite or the reciprocal motion. So now you're going to, not with your left leg, but with your right leg now, you're going to try and actively slide your heel down the wall further. So you're going to feel your hamstring, that is the back of your right leg, engage. You can have some implications at the hip, so do your due diligence to try and really engage the posterior elements of your hamstring and your gastroc, that is your calf muscle, to flex the knee rather than the hip. And you do this for 30 seconds. And then when you are done with the second 30-second contraction, you're going to so judiciously and slowly come out of the position because it can otherwise be quite stiff after such an intense bout of what we can call stretching, but really on knee range of motion, isometric contractions.